Welcome to our presentation on ensuring social inclusion of vulnerable seniors through technology, a collaborative community academic partnership. And as such, it involved a number of agencies, both government, non-governmental, university, and community. And these are some of the agencies that we worked so closely with and that provided some very valuable input at all stages of our program and project research. So before the global COVID-19 pandemic, seniors participated in person in physical and social programs offered by a variety of senior serving organizations. At Human Endeavour, for example, a senior serving organization in Toronto, Canada, more than 750 seniors participated in in-person activities each week at no cost. For many seniors, weekly program attendance at community organizations represents their primary social contact with friends with whom they develop, over time, trusted and deep connections. The closure of public spaces disrupted traditional activities for seniors and for senior serving organizations. Without in-person programs, COVID-19 immediately thrust most seniors into deep social isolation and precipitated fear, anxiety, and depression. At the same time, COVID-19 revealed the widespread lack of digital literacy among the older population served by senior serving organizations, most of whom lacked access to and knowledge of how to use technology. COVID-19 also revealed the inability of senior serving organizations to pivot quickly to online program delivery due to their lack of infrastructure, trained staff, and online support. In short, COVID-19 revealed four distinct problems, which we've outlined here on the slide. One was the cost, of course, of the information and communication technology, access to the internet, the different levels of digital literacy, the existing technology and solutions which were not designed for seniors, and the different levels of organizational capacity. There was a solution. Through technology, we were able to ensure the social inclusion of vulnerable seniors. In March 2020, Human Endeavour under CEO Noordin started the Technology Access and Support for Seniors TASS project. And now I'll pass the presentation over to Noor, and he will provide you with details of the project.
Thank you, Dr. Lewis, for the introduction and importance of technology. The project that we developed during early COVID to ensure the well-being and the social inclusion of our 750 seniors, we named it Technology Access and Support for Seniors. These are the three essential things for seniors who are vulnerable, who are low income, to actually get the technology in their hand. This particular project was designed and delivered as a fully integrated plug-and-play technology solution anywhere. It was just give an option for a senior to take the tablet, plug it in, and it should start working. It provided seniors with customized and friendly tablet layout. They were not standard tablets from the market. They were customized for the needs of our seniors. We programmed them with apps, cellular data, and internet connection, and cybersecurity software so that they feel safe and they have connectivity. We wrote easy to follow illustrated instruction book in multi-languages, offered online training and support also in multilingual languages through a phone helpline. We implemented remote login feature to the tablet that allowed us to debug and support the clients when they face some technical difficulty. It's a fully scalable solution for Canada and the world. Some of the objectives that when we started the project, were to ensure that technology is easy and friendly for seniors. We also wanted to reduce technology complexity for seniors and for senior serving organizations through customization and simplification of the tablet design and layout and everything else. We wanted to make TASS plug and play by integrating all necessary components that were needed for seniors along with the apps that were preloaded. Seniors' anxiety was reduced by providing real-time support and simplified operations. where they can call and get help if they face some difficulty. Improved access by setting up loan tablet pools across Ontario, Canada. We had around more than 750 tablets now. Make TASS accessible and automated. We made it accessible from people or seniors with disability point of view. And we ensured an encouraging technology experience for technogenarians, older adults using technology. This just looks like the simplicity of our phase one during COVID tablets. You can see we have taken out all the unnecessary apps that you normally see on a regular market tablet that's not designed for seniors. We made the fonts bigger. We created the contrast and also only put what was needed. The backside on the right bottom just shows you the telephone helpline and the unique tablet number through which we can remotely connect on the internet to this tablet. Again, some other essential markings are also there. Now, the participation in TASS was that because it was a scalable program, very quickly it expanded beyond human endeavor boundaries, and more than 30 nonprofit organizations in various capacities in urban, rural, and remote communities are collaborating with human endeavor to make sure their seniors also benefit from it. During the research phase or evaluation, 400 plus seniors received these tablets across Ontario, and they were using it. By 2022, we have more than 750 of these tablets in various communities. Helpline call center has handled more than 20,000 technical support calls and interactions from May 2020 to July 2022. We do monthly capacity building workshops that has benefited more than 200 organizations and 4,000 seniors who are associated with those organizations. When we originally introduced our first phase regular tablets, the issue of seniors who had disability came, and we wanted to tackle the disability and make the tablets accessible. So we improved the tablet and put a number of accessibility features that made these tablets available for seniors who were blind or low vision. And their tablets were all activated through voice. So we programmed their voice and they could run any app on the tablet with just their voice. The seniors who were deaf or low for hearing, through closed captioning and text-based apps that were put on the tablet. And people who had fine motor skill or difficulties, through combination of voice and text-based apps, they were able to use these tablets. This is what the accessible tablet main screen looks like. But the main screen from a senior who is blind and or cannot see the screen is irrelevant. But it just shows you the layout of the apps. But for a senior who is blind, they will just run every app that you see here with the voice command. Thank you.
And now I want to spend just a few minutes to talk about the evaluation process. It's extremely important for Noor and for his team to have research-informed practice so that they'll know what the next steps are and, any sort of glitches that need to be corrected and just how to move forward. So the first stage of our evaluation process went from July 2021, and that was establishing our research protocol, ethics approval, those kinds of things. Stage 2 was data gathering, and we used both a survey with seniors and an instrument that gathered interview data from both managers and seniors. And stage 3 was, of course, the data analysis, the final report, and the next steps. And that took us from November to January 2022. And because this is a collaborative academic community partnership, feedback from all the important stakeholders, all our community organizations and partners was essential at each of these stages of the research process. So the average age you can see here is 74, disproportionate number of female to male, which is not uncommon. We had a close to 85% female, 13% male. The majority of the people that we interviewed, 47% lived on their own independently, 22% with a spouse or partner, and 30% with family. It was a wide range of languages, and you can see some of them here. And it was important, of course, to serve people as best as was possible in the language that in their first language, the language with which they were most comfortable. And then there is the issue of digital literacy. And for most of the seniors, there was none to basic literacy. So we distributed about 400 surveys, 105 were returned, completed. In terms of the interviews, we interviewed 2 key informants, which were one was a funder, the other a government, municipal government agency that supported our work. 13 program managers from senior serving organizations and 29 seniors for a total of 44 interviews, 5 of which were conducted with interpretation and 2 of which required accessible tablets. In terms of the findings, which, as I said, were critical for moving on to the next stage of the program and the next stage of the project, was that we did find that TASS bridged the digital divide and enhanced digital literacy, certainly lessened material barriers since the tablets were free to seniors. It enhanced social connections, and as a result, it helped sustain their physical and emotional health and well-being. It facilitated aging in place, and it importantly, identified the need for further research and development. This, I think, is a very nice way to see how it benefited the seniors and what the impact was. In terms of digital literacy, 92% of seniors said that they would have had difficulty joining virtual group programs. So they certainly would not have been able to access those programs, which means they would have been significantly isolated during COVID and even post-COVID, because as we learned, the tablets enhanced their ability to stay connected when they weren't well, perhaps, or when they needed to be away. 51% of the seniors spent 1 to 2 hours online, 36% spent up to 4 hours, and 13% more than 4 hours. 71% of seniors have called the TASS helpline 2 or more times for technical support, and 92% said that the TASS helpline was useful in supporting them with tablet use. So that really points out the need for not simply giving people the hardware and the software. They really do need to have access to technical support. And I think all of us can relate to that, even when we're not seniors, just in our own work lives. 85% of the seniors who used TASS tablets felt more comfortable using the technology. 84% wanted to keep the tablets even after the pandemic ended. And that was something I heard from almost every senior I interviewed. Can we keep them? Is it going to be something we can keep? And 75% of seniors would like activities to continue online post-pandemic. In terms of the impact on social connections and physical and emotional health, 85% agreed that the TASS tablets helped them maintain their social circle. 86% agreed that it helped maintain their physical and emotional health. And that was not only through their social connections, but also through access to their healthcare providers, something which they really counted on, particularly during COVID. 79% agreed that having their own tablets increased their independence. And they indicated that they were not only able to maintain connections, but actually made some new friends, which was wonderful. And 70% of the seniors attended more community programs than they had pre-COVID. And now I'll let Noor discuss how this evaluation impacted the next phase of the program.
Sure. Thank you, Lois. So next phase, learning from our phase 1 and phase 2 brought us to, with the feedback of a number of partner organizations and caregivers, that seniors with early Alzheimer's and dementia was one large group that needed some sort of tablet design. We have developed what we call a senior-friendly, accessible technology that is now automated for seniors with early Alzheimer's and dementia. So the features of this phase 3 are, it's an interactive, automated, and it communicates with senior and their caregivers throughout the day. It has built-in reminders that were recommended from 41% of the respondents to implement in the tablet. These are voice-activated on a pre-scheduled times throughout the day. We have implemented in a calendar that's communicated through voice to the seniors, and then response is communicated to the caregivers as well if needed. ADLs are written in the calendar and automation software converts them into voice. The automation automatically starts various apps, for example, Zoom and Skype. If we have given a specific Zoom ID and password, we can let the software start that for senior on a certain time. If activities of daily living are not completed, then caregivers are informed. Smart watch, which comes with the tablet, can track wandering or location with a cellular smartwatch and inform the caregiver if a senior leaves home. I just want to give you an example how a reminder will work. So if it's a medication reminder, tablet will inform the senior to take medication at 3 o'clock through voice. Every 5 minutes, it asks the senior if he or she has taken the medication or not, and it's expecting a yes response from the senior. If a tablet does not get, it informs the caregiver that senior has not taken the medication, and then he or she can follow up. So this is how sort of the screen will look like. Some of the, again, apps that are here, they can be for seniors who are blind or others. Again, these are irrelevant because they run everything through their voice. For seniors who have Alzheimer's and dementia, they can use voice to activate all these apps that are here or some that are hidden. The watch that does the wandering or other recording and let the caregiver know is just identified here as well. Yeah, so I think based on our technology background experience of 35 plus years as engineers, we have implemented the 3 solutions that I have talked to you about. The second phase of the phase 3, which is where we are going to implement sensors in seniors' home, and they will tell us how many times they have went to washroom, how many times they have eaten food, or how much time they have slept. That is an enhancement to phase 3 that I have just talked about, and we are hoping to release that in January or December timeframe in 2022. That will make the solution complete, and further automation will be implemented because we can, based on ADL, we can determine the health and well-being of a senior. Next 3 phases of our development are, one is how these solutions that we have developed that are scalable, they can be implemented at a large scale. Once the phase 3 is complete, we would like to implement this in a building where seniors live. It could be a senior residence, it could be a nursing home. The benefit of these automation tablets and the sensors will be twofold. One, it ensures the quality of life of senior because he or she will receive the service as soon as, and that also helps on the other side, the staff of the nursing home or long-term care, because they can prioritize who will get the services rather than go in every room and deliver the service where it's not even needed. So I think it will have significant enhancement or efficiency improvement for the staff as well. The next phase is after the building is automated, or we can say the building is made smart for our seniors. We would like to move into the sections of the city where seniors live and make them smart through further building further intelligence or machine language learning, and make the city a smart city for the seniors to live. And one thing that I have not shared here is the vital sign monitoring. The way we are doing ADL monitoring, we can also do vital sign and chronic disease management related recording of various things, and then also pass them on to ensure that the health and well-being of seniors can be taken care of by monitoring those things. The solution that we have developed is not localized for Canada. If somebody is in Poland, they can put a local SIM, it should work there as well. So it's a universal solution that can be used across the world. Thank you.
And the following is contact information. And certainly I know Noor would welcome any communication, questions, comments that you may have. And he can be contacted directly. There's a cell number here. And an organizational email and website. And my contact information is below at York University, and it's certainly welcome as well. Any comments or questions that you may have. So thank you again, and we look forward to hearing from whoever has been listening to our presentation.